This morning we'll be looking at medical overview and, as time allows, respiratory emergencies. So chapter 16, medical overview. Introduction. Patients experience either a medical emergency, a trauma emergency, or they can have a combination of both. Trauma emergencies involve injuries resulting from physical forces applied to the body. Medical emergencies are specific to illnesses or conditions caused by disease. The types of medical emergencies that you need to be familiar with in terms of the anatomy and physiology, pathophysiology, and appropriate treatment as an AEMT, respiratory emergencies, which is very common, cardiovascular, also very common, neurologic, very common, gastrointestinal, and urologic emergencies, endocrine, which is also quite common, hematologic, immunologic, common, toxicologic emergencies, psychiatric emergencies, and gynecologic emergencies. Patient assessment. Medical patient assessment focuses on the nature of illness and symptoms. The information that you receive from dispatch will guide your initial response, and you will also focus on the patient's chief complaint. However, do not develop tunnel vision. With medical patients, they can have typical presentations and they can have atypical presentation. Your ability to do a proper primary assessment is going to be very important. Your ability to thoroughly obtain a detailed history is also going to be very important. And based on that history, if the patient falls within your protocol guidelines to administer meds, then you will administer meds once it's within your protocol. Scene size up. So ensure that the scene is safe, determine the number of patients needing assistance, nature of illness, and maintain a high index of suspicion, which is the worst thing that you think could be happening to the patient. After you've completed your scene size up, the next phase is your primary survey or primary assessment. You will form a general impression of the patient and the environment. The general impression should focus on conditions that may not appear serious at first. Determine the level of consciousness using your AVPU scale. And once you check for their level of alertness, you also need to look at their orientation to person, place, time, and event. Identify life threats by quickly assessing the patient's ABCDEs. Primary assessment, airway and breathing. Responsive patients. For your responsive patients, ensure airway is open and breathing is adequate. Apply oxygen if breathing has been affected. Open airway for unresponsive patients. And all of this will be based on your assessment findings, because you cannot treat something that you have not assessed for. So an assessment must be done, then the appropriate treatment be provided to the patient. After we have completed our assessment and management of upper airway and lower airway, we will focus on the assessment of circulation by checking radial pulse in the responsive patients, checking carotid pulse in the unresponsive patients, observing the patient's skin color, temperature, and condition. Identify and address life threats. After your ABCDEs, at that point in your assessment, you should know your patient's GCS. You should know if it's a load and go patient. You should know if it's a stay and play patient, and you should know if a rapid scan is required. And for a medical patient, a rapid scan is required if the patient cannot effectively communicate to you what is happening. So transport decision. Patients in need of rapid transport, unresponsive or altered mental status, lights and sirens. Here we are, breathing problem, emergency transport. Obvious circulation problems such as severe bleeding or signs of shock, load and go. After we have completed the primary survey or primary assessment, the next phase is your history taking, which is very important to medical patients, whether you can get information directly from the patient, family, or bystanders or the scene. Your ability to gather information is important to medical patients. And these are the emergency calls that will define you as an advance. So these are the calls that will really define you as an advanced EMT. So investigate the chief complaint. History taking may include both a history of the present illness using the OPQRST and a medical history. Obtain a sample history. So use your OPQRST mnemonic. Record allergies, medications, medical conditions and medications. Look around the scene for evidence. Obtain history of unresponsive patient from family members, friends, or bystanders, or from the scene itself. And if you're on a location where you're not able to get adequate info on the patient, then it's very important that you include pupil reaction, GMR, and pulse oximetry in your vital signs. Very important. Now, after the history taking phase, we have the secondary assessment. This is designed to identify any signs or symptoms not found during the primary survey. It may occur unseen or en route. It depends on the patient's presentation. Physical examination, responsive patients, limited or focused assessment. So if your patient is responsive, you're going to do a limited or focused assessment based on the system that is being affected. If your patient is not responsive, then you have to look at the entire patient, and this is where rapid scan become important, or a detailed physical exam becomes important. Obtain a baseline set of vital signs, recorded vital signs at this time, and you will compare them to your findings in the primary survey. In the primary survey, you found problems, you started to treat it. Your vital signs at this point will tell you if your treatment is working or not, or you need to upgrade or downgrade. Reassessment. So after the secondary assessment, the final phase of the assessment is reassessment. Perform after treatment. Repeat primary survey and reassess chief complaint. Reassess the patient's vital signs. You're looking for trends. Is your patient trending up or trending down? Review all treatments that have been performed. Document any changes. Alert ED before arrival of potentially critical patients. Now, management, transport, and destination. So for management, transport, and destination, important. Treatment for medical emergencies is not available in the pre-hospital setting, so there are limitations. May require testing at a hospital. Administration of medication is limited. Permission from medical control is required. So even though limited, you may be required to administer certain medications, but that will be based on your medical director supervision or protocols. AEMTs can use AEDs on a patient who is pulseless and apneic. Scene time. Now, your scene time for your medical patients may be longer for medical patients than for trauma, because we have to really try and get as much information as we can, because it's going to be very important to the way the patient is treated. Critical patients, however, will require rapid transport. So if you determine that your patient is critical, rapid transport. So life-threatening conditions, lights and sirens. Non-life-threatening condition, consider non-emergency transport. And be mindful of your lights and sirens, especially for your patients that have severe migraine, history of seizures, or a patient who we suspect is having a myocardial infarction, because the lights and sirens can trigger complications in these patients. Now, ground transport takes the form of BLS response and ALS response. Within the BLS response, EMTs respond on that unit. Within the ALS, it's going to be AEMTs or paramedics. And if air transport is required, it's going to be critical care transport or critical care providers, which can be a nurse, can be a paramedic, it can be a paramedic with a doctor, it can be a paramedic with a nurse, it can be a paramedic that is a nurse. Destination selection. Generally, the closest hospital with an ED is appropriate. However, ensure that where you're taking the patient, they have the resources necessary to give the patient the best chance of surviving, or they have the specialties that the patient requires. Patients may benefit from transport to specialized facility. Contact medical control when you're not sure. Some patients benefit from on-scene treatment by paramedics. So if ALS is requested and if the paramedics arrive and it is a situation that they can provide management in the field and stabilize the patient, that's what they're going to do, because it doesn't make sense for them to rush with the patient, take the patient to the hospital, and the doctors are going to do a treatment that they could have done in the field. So once they're able to provide a treatment, it's going to be provided in the field. Right. Now let's look at some infectious diseases. So the first part of the medical overview focuses on the type of medical emergencies that you would cover, how you assess these patients using your patient assessment algorithm, and what you need to consider in terms of transport and destination. The next half of the chapter looks at infectious diseases. Infectious diseases, medical condition caused by growth and spread of harmful organisms within the body. A communicable disease is able to spread from one person to another person or species to another. Assess like any other medical patient. Size up the scene and take standard precautions. And of course, standard precautions are going to be extremely important if you suspect a communicable disease is present. General management principles that you need to consider. Focus on life-threatening conditions. Be empathetic. Make the patient as comfortable as possible. Follow standard precautions. Don't put yourself at risk. Now, an epidemic occurs when there is new cases of a disease in a human population more than is expected at a particular time. A pandemic is an outbreak of a disease globally at a particular time. HIV infection and AIDS. Potential hazard only when deposited on a mucous membrane or directly into the bloodstream. Primarily a sexually transmitted disease, but also a blood-borne disease. And persons who are addicted to illegal drugs that they take via the IV route are high risk because these patients share needles, so they are at high risk for blood-borne transmission. The immune system begins to fail when a patient has HIV. Many patients show no symptoms. Now, symptoms may include sudden febrile illness, weakness, fatigue, sore throat, swollen spleen and lymph glands, headache, weight loss. Now, HIV will progress to AIDS, which is acquired immunodeficiency syndrome, end-stage disease process caused by HIV infection. No vaccine exists as yet. Pre-hospital management is going to be supportive. Despite great progress in drug treatments, AIDS is still fatal after many, many years. Risk of infection is limited to exposure to an infected patient's blood or body fluids. Wear proper gloves, handle needles, scalpels carefully, cover open wounds, good hand washing, routine ambulance cleaning. These are important things to keep in mind. Seek medical advice if potentially exposed. Influenza or flu, transmitted by direct contact with nasal secretions. These nasal secretions are aerosolized as droplets when a person coughs. Sneezing by infected people can cause transmission. So it can be direct contact with nasal secretions. It was aerosolized because the person was coughing or they sneeze. General treatment includes supportive treatment. An annual influenza immunization is important, especially for EMS personnel, and that's mandatory in the state. So every year you have to take a flu vaccine in the year. That's kind of mandatory. It has to be every year because the influenza virus constantly changes or mutates. Hepatitis. Hepatitis is inflammation or infection of the liver. There are 3 types of hepatitis that are viral. That would be A, B, and C. And C is the one that causes cirrhosis of the liver. The management is going to be supportive. Early signs that you can look out for: the patient is complaining of weakness, if they have a loss of appetite, nausea, vomiting, they have fever, sore throat, cough, muscle, or joint pain. Advanced symptoms would include jaundice, which is yellow eyes and skin, and they will complain of right upper quadrant pain to the abdomen. Not sure way, there is no sure way to tell which patients are contagious, right? It's impossible. Carriers may or may not cause an active disease, and they can infect others. Hepatitis B vaccine is highly recommended. Seeking testing following vaccine to determine immunity is important, and most services in the States and certain organizations in Jamaica will provide the hepatitis A and B vaccine to their employees. Herpes simplex, common virus strain carried by humans. More than 85% of persons who have it are asymptomatic. Symptomatic infections cause eruptions of tiny fluid-filled blisters. Infection occurs through close personal contact. Standard precautions generally sufficient to prevent transmission. So standard precautions will give you good protection. Syphilis, sexually transmitted and bloodborne. Small risk for transmission through contaminated needle stick injury. Direct blood-to-blood contact can also cause transmission. Initial infection produces a canker sore, most commonly located in the genital area or region. Meningitis. Meningitis is inflammation of the meningeal covering of the brain and the spinal cord. Symptoms include fever, headache, stiff neck, altered mental status, photosensitivity. Meningitis can be viral or it can be as a result of a bacteria, so it can be caused by viruses or bacteria. The meningococcal meningitis is the one that is highly contagious. Only lab tests can determine the type. Take appropriate standard precautions, and it is treated in the ED with antibiotics. And there are vaccines for it, but I'm not sure if that vaccine can be obtained in Jamaica. Can't get it in the States though. The vaccines are rarely used. Contact your employer health representative if you treat a meningitis patient. Reportable in many states, so if you come in contact with a patient that possibly has meningitis and you're working overseas, specifically in the States, it has to be reported. You may be contacted if you handle a patient diagnosed with meningitis. Tuberculosis. Tuberculosis is a chronic mycobacterial disease that usually strikes the lungs. Many infected patients are well most of the time. Highest risk patients usually have a cough. Consider respiratory tuberculosis to be only in its contagious form. N95 or HEPA masks are required to prevent inhalation of droplet nuclei. There is no absolute protection. Everyone who breathes is at risk. 1/3 of the world's population is infected with tuberculosis. Vaccine rarely used in the United States. Mechanism of transmission is not efficient. Have a tuberculin skin test regular. And this is another requirement to work in some places in the States. You have to do a tuberculin skin test. If it is positive, then you have to do a chest x-ray to ensure that you don't have issues with your lungs. Pertussis or whooping cough. It is a contagious disease. It's an airborne disease caused by a bacteria, now common in adults whose vaccination was years prior. Symptoms include fever and a whoop sound when the patient tries to inhale. So essentially they have flu-like symptoms. However, they develop this cough, this unusual cough. So they have a coughing fit. It's so severe that during the coughing fit, they can't breathe properly. So after the coughing fit, they take this deep breath in and it causes a whooping sound. It's also referred to as the 100-day cough. The best way to prevent infection is to be vaccinated with the diphtheria, tetanus, or a cellular pertussis vaccine. Methicillin-resistant Staphylococcus aureus or MRSA. This is a bacterium that causes infection. But the infection that occurs is resistant to most antibiotics. Nosocomial infections are believed to be transmitted from patient to patient by unwashed hands. Use gloves and practice good hand washing. Factors that increase the risk of MRSA: if the patient is on antibiotic therapy, if they're in the hospital for a very long time, if they're in ICU or they're in a burn unit, if they have been exposed to an infected patient. All of these things increases their risk of catching MRSA. The incubation period is between 5 and 45 days. No post-exposure treatment is recommended. Incident must be documented. Now, new emerging disease, hantavirus. The hantavirus comes from a family of hantaviruses and what hantaviruses are is really viruses that are spread by rodents. And the virus can cause issues with the lungs, it can cause hemorrhagic issues, bleeding problems, and it can cause problems with the kidneys. So hantavirus, rare but deadly virus transmitted through rodent urine. Hantavirus, rare but deadly virus transmitted through rodent urine and droppings. Not transmitted from person to person. The transmission is by a vehicle such as a food or a vector such as a rodent. The West Nile virus, this is a virus that is transmitted by mosquitoes. And it's very rare. 1 in 5 will catch it. 1 in 5 persons will catch it. 1 in 50 will become severely ill. But when they become ill, it is usually linked to encephalitis or meningitis. So it can lead to encephalitis or meningitis. So the vector is the mosquito. It's non-communicable and it poses no risk during patient care. Now, severe acute respiratory syndrome, SARS. And by now we are very familiar with the SARS type virus. Potentially life-threatening viral infection begins with flu-like symptoms, may progress to pneumonia, respiratory failure, and death. Transmitted by close person-to-person contact or by secretions. Avian bird flu, transmitted through close contact with infected birds. No rapid human-to-human cases reported. The risk of transmission is very low. Global issues: Middle East respiratory syndrome, coronavirus, MERS-CoV. most commonly found in bats and camels living in the Middle East. Cases of human infections have also been reported in Europe and the United States, and I believe this was from 2012. Can double check me on that. Symptoms include high fever, cough, muscle aches, vomiting, and diarrhea. No cure or vaccine at present, and they are experimenting with vaccines. No, so that might change in the future. Ebola. The incubation period is approximately 6 to 12 days after exposure, and this is a virus that ultimately will cause issues, serious problems with the blood. Symptoms include watery diarrhea, vomiting, fever, body aches, and bleeding. The fatality rate is very high because of the issues that it causes with the blood. The Zika virus, it's a vector-borne infection transmitted by mosquito bite. No vaccine exists as yet. Symptoms include fever, rash, joint pain, conjunctivitis. Most significant complication is associated with pregnant women, so it can cause some serious problems in the pregnant woman or women. Travel medicine. Patients who acquire an illness from another country can present with a variety of symptoms depending on the illness. Place a mask on the patient and gather as much information as possible. In case of a communicable illness, follow appropriate PPE guidelines or precautions and notify the receiving facility. Important questions to consider. Where did you recently travel? Did you receive any vaccinations? Were you exposed to any infection or infectious disease? Sorry. Is there anyone else in your travel party who is sick? Which types of food did you eat? What was your source of drinking water? Now, in conclusion, assessment and treatment of medical patients can be very challenging. These are going to be the most challenging calls for you as an AEMT. Medical patient's condition may not be readily apparent as in a trauma patient. So you could have a trauma patient with a serious medical emergency going on, which led to the traumatic event. Best approach. Keep calm. Use your patient assessment skills, which must be sequential. Treat patient symptoms while maintaining a high index of suspicion. That's the worst possible thing that could be occurring. Communicate with medical control as needed. Transport the patient safely to the closest, most appropriate facility. Keep in mind that patients sometimes have more than one isolated problem. And that brings us to the end of this chapter. So that's medical overview.